CDC data reports at least 41 cases of measles across 16 states so far this year. The rise in cases marks one of the steepest increases in recent history of the virus at this time of the year. Experts worry this year will rival or be worse than 2019, when more than 1,200 people in more than 30 states had measles. Scripps News science and health correspondent Lindsay Thies has more.
Measles cases continue to rise. The CDC says we see measles cases rise for two main reasons. More travelers get infected abroad and bring it back to the U.S., and more spread in communities with pockets of unvaccinated folks. Both are happening now. Dozens of measles outbreaks across at least a third of the country and counting. The spread stressing parents and doctors alike.
I've been seeing the headlines that it's definitely a thing now.
It's a little bit scary to think that something that killed so many children in the past is resurging again.
We could expect to see more and more of these cases.
Measles symptoms usually begin 10 to 14 days after an exposure, and they include runny noses, coughing, red watery eyes, small white spots inside the cheeks, and rashes. The CDC says about 1 in 5 unvaccinated people who get measles are hospitalized, and it can cause brain swelling, pneumonia, even death.
Fewer of our young children are protected against diseases like measles or polio.
Meanwhile, health officials continue to ready doctors to see more cases and urge parents to vaccinate. At least 95% of a population must be vaccinated in order to meet herd immunity for measles, when enough people are immune and protect those who are not.
Measles is the canary in the coal mine. We're reversing progress over the last decades and turning back the clock on so many of these childhood diseases.
The measles vaccine has been around since the 60s. Doctors recommend the MMR shot, measles, mumps, rubella, in 2 doses, first at 12 months and a second at age 4 to 6. It's 97% effective, protecting against measles, and lasts for life. Lindsay Thies, Scripps News, San Francisco.
So how worried should we be about this uptick in cases? Let's bring in Scripps News Tonight medical contributor Dr. Omer Awan. Dr. Awan, let's start with that. How worried should we be here?
We should be worried, Christian, because there should be 0 cases of measles here in America. You know, back in the year 2000, it was thought that measles was eradicated in the United States. And the fact that we've already seen 41 cases across 16 states, we should absolutely be worried. And this is a bad trend because, you know, the more cases that we see, the more it suggests that people are hesitant to get vaccinated. Parents are hesitant to give their children vaccines. And, you know, this is going to cause a lot of problems going forward if more and more cases start to come. And this is all coming because parents are not vaccinating their children. All the cases we've seen, nearly every single one of them has been because either someone has traveled somewhere where they've gotten infected or because people are not vaccinated. So extremely important for kids to get the vaccination when they're 12 to 15 months, and then also when they're 4 to 6 years old.
Dr. Awan, you mentioned this was eliminated back in 2000. And, you know, through the course of time, we imagine science and technology, health technology getting better so that these things don't come back. But clearly, we've seen a resurgence. What is it that we're up against that is really, you know, helping cause this resurgence? You mentioned parents are not vaccinating their children. I mean, what's different now? What's different about the landscape now that we're actually seeing this resurgence? Why aren't parents vaccinating their kids, for example?
Yeah, I think that's a great question, Christian. I think part of it has to do with the misinformation that's out there. A lot of Americans feel and truly believe that the measles vaccine is associated with autism. You know, this is misinformation and disinformation that's been propagated along social media and, you know, many different outlets. And that could not be further from the truth. You know, there's no scientific evidence to suggest that the measles vaccine can cause autism. So that's one part of it. I think another part is just the mistrust in people and people have with science. And this has been amplified with the COVID-19 pandemic where, you know, vaccines have been politicized and, you know, through political ideologies, you know, people have refused to get vaccinated. And, you know, this is the life of children. We're talking about the health of our own children. You know, the health of our own children should not be due to political ideologies or baseless information that has no facts. This should be based on facts and science.
Babies get their first dose between 12 to 15 months. For kids who are in daycare before then, and this is for the parents out there, parents, guardians, what does prevention look like for those young children with the last 45 seconds we have left, Dr. Awan?
Prevention is simply by getting vaccinated. That's what it comes down to. This is very easily prevented by getting, 2 vaccines. You get even one vaccine, it's 93% effective. You get both vaccines, one at the age of 12 to 15 months and the other between 4 and 6 years of age. It's 97% effective. It's literally as simple as that, getting those childhood vaccines that most of us get. And, once we get herd immunity, and in the case of measles, it's about 95% of the population gets the vaccine, then we're all safe, but then when that starts to decrease and wane, as it is in many of the states and communities that we're seeing here in America, it becomes a problem and then people get infected. So the bottom line is we need to get vaccinated.
And just before we let you go, for the kids who can't get vaccinated yet, what does prevention and safety look like for them?
Well, if you're an infant, you just want to be mindful, try to stay away from, areas where people may potentially get the virus. The virus is extremely contagious. So, if it's in the air, it can last in the air for up to 2 hours. So very easy to get infected, kind of stay away, wash hands regularly. If you do the basic common sense things that we typically do for all viruses, you can try and stay as protected as possible.
These are the things that we've been hearing time and time again over the last few years, so it's good to hear it again. Scripps News Tonight medical contributor Dr. Omer Awan, many thanks as always, my friend.
Thanks, CB.
Still ahead, a question of whether